Following information is presented for discussion and educational purposes only and is not intended or provided as treatment information for any specific person or behavior. If you or a loved one is having behavioral difficulties, you are encouraged to seek professional consultation as soon as possible. Ladies and gentlemen, welcome to episode 6 of Ask the Behavior Doctors. We're here in Scottsdale, Arizona, bringing you some of the latest information, answering your questions about behavioral science and how it can help you, your family, your children, and anyone you interact with. So today we're going to talk about two things. We're going to talk about school readiness, and we're going to talk about the concept of co-parenting. Some recent research has come out that I wanted to share with you guys that I think will be pretty helpful in that. So the first thing we're going to talk about is school readiness. Recently, a study was done in Louisville, Kentucky, in their district, that showed that 73.8% of children who attended at least one day of a kindergarten camp or a kindergarten readiness course were ready to start school, compared to a district average of 56.1% of children, obviously, who do not attend a kindergarten readiness camp. So this is, big news. This is definitely important. This is something I share with parents all of the time. Many parents will come to me with their young children and they'll say, hey, Jake, I'm just not sure whether my child's ready for school or not. I'm not sure whether they are skill-wise ready. I'm not sure if they have the behaviors necessary. I'm not sure if they're academically ready. And I tell parents all the time that, well, your kid's not going to get ready on accident, and it's not going to happen on accident. It's not going to happen by chance. I tell parents, let's look for some school readiness programs, some places that really push school readiness. So we had such a high demand for this school readiness skills program that we actually created our own here. So Scottsdale PBS is partnering, and we have at the other end of our building a place called the Scottsdale Children's Institute. And part of the mission of the Scottsdale Children's Institute is to practice, disseminate, and research the science of teaching and learning. But one of our big programs down at the school is going to be school readiness. We're having an intensive school readiness program at the Scottsdale Children's Institute that is going to really push these kindergarten readiness skills. These skills can range from adaptive skills, academic skills, social skills, emotional and behavioral regulation skills. Most schools don't teach kids how to sit at circle time, how to stand in line, how to raise their hand. But that's what our program here at the Scottsdale Children's Institute is going to push. We're going to build all of those skills necessary for a student to adaptively function as a whole student in the school environment. So I wanted to give my parents a list of things to look for, signs to look for, to see whether your child is school ready or not. So one of the first things is, are they making progress that's similar to their peers in the preschool environment? If they're not progressing like their peers, it's probably one of your first red flags that, hey, something may be deviating here. And I want to emphasize too, that doesn't mean anything's wrong with your child if they're not progressing at the same speed as other kids. Some kids move at different speeds than others. Some kids need a different approach. Some settings are not appropriate for some children. Some children will respond to a different style in a better way. So again, not necessarily saying anything's wrong with your child, but these are things to look for that may indicate that your child would respond well to a school readiness program. So number one, they're not making similar progress to their peers. Number two, they have some but not most of the necessary skills to succeed in the classroom. So what I mean is, your child struggles sitting in their seat. Your child struggles keeping their hands to themselves. Your child struggles to stand in line, raise their hand, wait their turn, or to stay on task in the school environment. Those are things that skills they're going to need in kindergarten. And if they don't have, they're going to fall behind pretty quickly. Third thing is, they are clearly not ready to move up to kindergarten. They're barely staying afloat in their current environment. So obviously looking at your child and then looking at, and I recommend parents that you go observe an actual kindergarten classroom. Part of my job, what I do is I go to many classrooms and observe my patients or observe other children in that environment. I encourage you, go to a normal kindergarten classroom, a general education room, and look at what the average student is doing in that classroom. I think you'll be quite impressed And so my point is, after you see that, if you can ask yourself or tell yourself, my child is really not ready to move up to that level, they're barely staying afloat at the current level, well, again, that's probably a red flag that they could use some extra school training. They're frequently sent home or secluded from their peers because of behavioral issues. I know this sounds funny, but this is one of our most common issues here with our population. Many children that we have been, booted out of 3, 4, some of them 5 preschool programs. Some schools have very little tolerance for behavioral issues. Some schools have very little tools or resources to deal with behaviors. So a lot of times those schools will expel or suspend or just boot out some of these children who are not able to kind of fall in line quickly. The average kindergarten student that I observe has close to about a 90% compliance rate. So if your kid's not even close to a 90% compliance rate, meaning 90% of the time when they're told to do something, they do it. If they're not even close, that's probably a good indicator that they could use some school readiness training. They need to be able to sit independently for up to 30 minutes. The average kindergartner can do that in the classroom environment. If your child can't sit independently without your assistance or help, again, probably a good indicator they may need some school readiness training. They need to be able to complete non-preferred tasks for up to 20 minutes at a time. If your child can't do that, definitely an indicator they may need some more training. They need to be able to follow rules and pick up things by observing other students. A lot of times children may not hear directions or know exactly what's going on, but they'll be able to observe their peers and quickly kind of emulate and follow that behavior. If your child's not very good at that, that's definitely something to pay attention to. The average kindergarten student does not have major problem behaviors such as aggression, tantruming, or self-injurious types of behaviors. So if your child spends a lot of their day engaging in aggression or having blow-ups, tantrums, meltdowns, things like that, they may need a special approach, a special program that gets them more school ready. I tell parents, if in doubt, go ask their teacher. Ask their current teacher, do you think my child's ready for kindergarten? Do you think they're ready to go to all-day school environment at a general education public school? If that answer is no, maybe the teacher can give you some insight about what that student is going to need to work on. And if the teacher's not able to give you a good answer, go consult with a professional. A lot of times, a lot of preschools, so I would probably look for a school that you really like in your area, will offer free assessments or will offer courtesy assessments of your child, of their school readiness. So you can bring them to a school or a kindergarten and you can say, hey, can my child shadow or can my child sit in for just an hour? And can you guys kind of give me your opinion about whether you think my child's ready? Most reputable schools would be able to do that or something like that to be able to give you some information about how ready your child is. Remember, parents, school readiness is not going to happen on accident. If your child doesn't seem ready or if they seem behind, and especially if they don't enjoy school or are frequently engaging in problem behaviors at school, I highly recommend you getting on the internet or contacting some of your friends and looking for school readiness programs in your area. Again, if you're in the Scottsdale, Arizona area, we are here in North Scottsdale. Our place is called the Scottsdale Children's Institute, and our website is www.scottsdaleci.com. All right, so on to our question for the day. This is a question I've gotten recently from a parent that says, how important is it that my spouse and I are on the same page about co-parenting our children? So basically the question is asking, Jake, how important is it that my partner and I are consistent when trying to manage our child's behavior? Because we argue, we disagree, and we just don't see eye to eye about how to regulate our child's behavior. So this is actually a really good question and something I like to address with a lot of our parents. Co-parenting is important from a consistency standpoint, meaning behavioral procedures, just behavioral management from a parent's perspective is going to be more effective when it's done consistently. If contingencies are implemented consistently, if your child consistently needs to do the same type of behaviors to get the things they want in their environment, then that behavior is probably going to be exhibited at a more consistent rate in a more predictable way. So consistency is important, but what I want to encourage parents to do is take the focus off of the concept of good or bad, or right or wrong. Many parents want to focus on whose way is right, Jacob, whose way is wrong, which one of us is doing it the right way. I want you to take the focus off of good, bad, right, wrong and put it on effective or ineffective. As a behavioral scientist, I have very few judgments when I go into a home about exactly the right or wrong way to do things. My parents, I've worked with thousands of parents over the years who do things wildly different than I would do. There's cultural norms, there's all types of, just different types of ways to do things that you can't really judge it through that lens of right or wrong. You have to look at behavior especially as something that you're either effectively getting the behaviors you want or you are ineffectively not getting the behaviors that you want. So I want you to replace good, bad, right, or wrong with effective or ineffective. So this is what I want my parents to do. I want you to pick some target behaviors. Pick some things that you agree on that are important to consistently get from your child. My recommendation is to pick one target behavior to increase and one target behavior to decrease. The reason for doing this is that if you're picking things to increase and decrease, then you're going to be more likely to use a balanced kind of approach that includes reinforcement, praise, positive types of things, as you are kind of attending to that behavior to decrease. So I want you to pick that target behavior, and I want you to take data on that behavior each day, on each of those behaviors. You can pick more than one. My advice is keep it simple at first. Pick something that you and your partner really find important. Take data on that. Don't try and do anything different at first. This is what's called baseline data. So you take data on those behaviors and you see what's happening with them. Is the good behavior we want or the adaptive behavior we want increasing? Is the naughty behavior we don't want, is that decreasing? If that's not the case for both behaviors, that the adaptive one's increasing and the maladaptive behavior is decreasing, then we are not being as effective as we can. And again, I want my parents and I want to equip all of them to be as effective as possible. When you're effective, your child's behavior is going to be much more balanced. Your child's behavior is going to be healthier. Your child is going to probably be able to develop a healthier repertoire of behaviors that can be converted to multiple types of environments, okay? So parents, again, pick those behaviors, take your baseline data, see if you're being effective or not. And then I want you to be able to judge it through that lens of effective or ineffective. If you're not being effective, then what I want you to do is I want you to start talking to some other parents or seeking some resources, books, readings, websites, seminars, tapes, whatever you got to do. Start giving yourself some more tools to be an effective behavioral regulator, effective behavioral manager, okay? Then what I want you to do is to come to an agreement or try out some of those tools on that behavior to increase and that behavior to decrease. If you're still not successful after increasing your toolbox, increasing your knowledge of what you're trying to get from a behavioral perspective, then I would recommend seeking professional consultation. Remember, most healthy children with parents that are doing their best to have a normal environment will respond to basic interventions. Most children like praise. Most children will respond well to incentives. Most children react really well to consistent, steady, predictable environments. If you're doing that as a parent and you're doing what everything is telling you should be effective and your child's still not responding, well, then that might be an indicator that some kind of special accommodation is appropriate. Remember, getting back to that sense of co-parenting, your focus should be on effectiveness, not on right or wrong. If you're consistently getting the behaviors you want and consistently not getting behaviors you don't want, what more could you ask for as a parent? That's really the ideal, is that you are effectively managing the environment to get the best behaviors possible from your child. Now, going back to that co-parenting concept, what's happened is parents who aren't effective co-parenters, typically what will happen is one parent will be more coercive than the other parent. Coercive means that that parent uses begging, threats, emotional kind of intimidation to get the behavior that they want from the child. So what we find is that when parents aren't on the same page about co-parenting strategies, that one parent will overly rely on those coercive strategies. Again, that's not going to be very good, and that's not going to be able to generalize to multiple environments because that's not a healthy way to manage behavior long term. So, twofold reason. Not only are you going to get better behaviors from your child if you are good co-parenters, but you're probably going to get a lot less coercive behavior management if you guys have a strategy that consistently increases the good and decreases the bad. Parents, I want to thank you again for joining us today, for submitting your questions here to us at scottsdalepbs.com or at info@scottsdalepbs.com. We want to thank our photographer, Mr. Philip Carnevale, for joining us today. His website is www.philipcarnevalephotography.com. We want to thank you again for submitting your questions and joining us here at Scottsdale Pediatric Behavioral Services and Ask the Behavior Doctors.